Good afternoon, everyone. Thanks for joining us for another ATS University. My name is Zach Allison with ATS. I'm our market development manager, and I work with all the various national accounts across Canada and the US that have multiple offices. I manage our account management team that are reaching out to those same firms in various parts of North America to provide similar sessions like this, but also to provide demos on the spec tool and help get your firm situated and set up with various masters and everything on the spec tool. However, we run these ATS University sessions not to talk about us, but more so to talk about our manufacturers. The manufacturers that are on the ATS spec tool is really what gives it its life and its power. And we like to have deep dives into various applications, some of the key products, maybe new barrier-free codes. Like last week, we were having a great discussion on the barrier-free codes surrounding locker rooms, especially across all the US. So we show you later on how you can find those previously recorded sessions on the ATS spec tool, just atsspec.com. And then in the there's a tab there for the previously recorded webinars. I'll show you how you can get that at the end of the session today. But with me to talk about advances in plumbing design for healthcare with a big focus on the mental health field is Jerry Babin of Morris Lee. They are working with Whitehall for a number of years now, and Jerry's been one of my close colleagues, taught me a lot in this industry over the years. So it's great to hear from you again, Jared. Thanks for jumping on with us.
Hey, not a problem. Thanks for having me. Hello, everybody. Good afternoon. Hope you're enjoying the sunny summer weather we seem to be experiencing in the middle of March here. So with that said, Zach mentioned I'm with Morris Lee. I'm the general specifications manager here for Morris Lee. I deal with engineers and architects across the country with all our reps on all of our various product lines. And in particular, we're going to talk about Whitehall today.
And just before we dive into the agenda, one thing I've always been forgetting lately, I'm almost so used to saying it that I skip it. We do have the session recorded. I'll be keeping an eye on that so that we can get it hosted on the ATS Spec site for, if you want to come back and watch it again. If you miss anything, you'll be able to access it. And of course, we will be having certificates of attendance sent out to all those on the call, usually on Fridays. Our team will send those out. So keep an eye on those in case you need to self-report.
Okay, sounds good. Also, you notice the chat feature. So if there is any questions, please pose it. Zach will be watching that. And if we don't get through everything today, you can send the questions on to Zach. He'll pass them on to me. Or if you've got my contact info, contact me directly and I can answer whatever questions you might have. So purpose and learning objectives of today is healthcare facilities now are striving to meet the needs of all patients to offer not only health and safe spaces, but inclusive spaces as well. Recent advances in plumbing design for healthcare facilities are helping to keep all patients and caregivers safe and healthy. The course reviews innovations in plumbing design, how these designs support trending healthcare needs such as infectious prevention, behavioral health, bariatric, and ADA patients. Our objectives today is to identify design trends that benefit patients, mental and physical health, and which ones can be addressed through plumbing design. Define how plumbing fixture design and hand hygiene can address hospital-acquired infections. Discuss how proper dialysis plumbing design can protect the patient from infection and at the same time reduce plumbing construction costs. And explain how behavioral health design can affect patient safety. So what is health? Health is defined as health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. Trends in healthcare design. So some of the trends that we're seeing now, benefits of daylight, shorter hospital stays, improved circadian rhythms, decreased pain. Benefits in view of nature, room satisfaction, psychological response, improved blood pressure, decrease in the following, recorded pain, anxiety, fatigue, and pain medication. Again, you'll see in some of the images that you're seeing here, you've got inpatient rooms they're looking out at gardens, or they're seeing an oceanscape on the one side. Again, it's not a drab bland white room as most of us are kind of used to in seeing. So plumbing design and healthcare landscape. How does plumbing design fit in this changing healthcare landscape? Meets the rising demand of healthcare facilities and the renovation or expansion efforts to meet behavioral health and barrier-free requirements, provide access to products in all areas, and to help prevent the spread of infection. Some design trends in universal rooms and in hospitality and healthcare. Universal rooms have become more common and are replaced by specialized rooms. A variety of patients can be accommodated, including patients that need ADA accessibility, bariatric patients, behavioral health. Other benefits of a universal room, it allows the hospital to easily accommodate a patient with a variety of needs and conditions without having to reorganize or move other patients. Designing with the intention of helping to prevent the spread of infection is crucial to health and well-being of patients and caregivers alike. So we'll start off with hand washing and infection prevention sinks. So what are healthcare associated infections? They're infections that develop in the hospital environment that a patient did not arrive with. They cost between, and these are US costs, between $28 and $45 billion annually. Proper hand washing is proven to be the #1 way to reduce spreading infections. Healthcare associated infections are the 4th leading cause of death in the US, as well as being the #1 preventable cause of death. Proper hand washing for surgeons, for surgical scrubbing before operations. WHO states that the procedures for timed 5 to 10 minute, depending on facility guidelines. Scrub should consist of these steps: removing all jewelry, washing hands and arms with antimicrobial soap. Excessively hot water is harder on the skin, dries the skin, and it's too uncomfortable to wash for the recommended amount of time. However, because cold water prevents soap from lathering properly, soil and germs may not be washed away. Clean subbungal areas of a nail file. Scrub each side of each finger, between the fingers, the back and front of the hands for 2 minutes. Proceed to scrub the arms, keeping the hand higher than the arm at all times. This prevents bacteria-laden soap and water from contaminating the hands. Wash each side of the arm 3 inches above the elbow for 1 minute. And this is just basically showing you, this video was.
This video is for training purposes only. Surgical site infections, or SSIs, remain a prevalent threat to patient safety. Proper surgical hand scrub or rub techniques are essential to decreasing its incidence. This video provides instructions on anatomical surgical hand scrub procedure using the brush stroke method. If done correctly, this procedure should take 3 to 5 minutes. Before beginning the surgical hand scrub procedure, you must remove all jewelry from both hands and arms. Inspect your skin and nails. Ensure your skin is free of any cuts and wounds. Nails must not extend past your fingertips, and nail polish must be intact without chips or scratches. Remember, acrylics, artificial nails, and nails with foreign bodies are not allowed in the operating room. Put on your personal protective equipment. Make sure your hair and ears are tucked into your surgical head covering and that any neck jewelry is contained in your surgical attire scrubs. Don the proper eye protection and a surgical mask covering your nose, mouth, and if applicable, facial hair. To begin the scrub, tear open a sponge of your preferred hospital-approved antiseptic, either chlorhexidine or betadine, also known as povidone. Place the open packet on the shelf above the sink with the tear facing the ceiling. You must pre-wash your hands and arms only if this is the first case of the day or if your hands are visibly soiled. Use the soap from the dispensers located within the scrub sink or in a separate container above the sink. Then, use the disposable nail pick and clean under your fingernails under running water. Dispose of the nail pick in the trash can beside the scrub sink and rinse hands and forearms. Once hands and arms have been washed, remove the sterile surgical sponge from its wrapper and moisten the sponge under running water by squeezing and releasing it. With fingertips together, use a light but firm pressure to stroke the nails in a back and forth motion with the abrasive brush side of the sponge approximately 30 times. The abrasive brush side is only used on your fingertips. The non-abrasive side should be used for the remainder of the scrub. Next, turn the surgical sponge over to the non-abrasive side. Place fingers side by side, including the thumb, and scrub the surface of the palm 10 strokes. Then, turn the hand over and scrub the dorsal surface 10 strokes. Next, scrub the outside surface of the thumb from wrist to tip of the thumb 10 strokes. Continue to apply 10 strokes to the other side of the thumb and to each side of your fingers. Once you scrub an area, do not go back. Now that you scrubbed your hand, it's time to scrub your arm on the same side. Mentally divide the forearm into thirds from wrist up to 2 inches above the elbow. When scrubbing each third of your forearm, apply 10 strokes to the top, bottom, and both sides of each section. Like before, once you scrub an area, do not go back. Repeat the scrub on the other hand and arm. Once both hands and arms are complete, discard the surgical sponge in the trash can beside the scrub sink. Start rinsing at your fingertips and continue to the hand, forearm, and elbow, moving in one forward direction through the water. Always keep your elbow at a right angle and hand raised above the level of your elbow. Do not move arms back and forth in the water. If you need additional rinsing, completely remove your arm from the water stream and re-enter at the fingertips until you reach the elbow. Once rinsing is complete and no antiseptic remains on the hand and arms, turn off the water with the knee control. To avoid contamination, keep hands above the level of the elbow and away from scrub attire and non-sterile surfaces. Allow residual water to drip off the elbows and into the sink. Do not shake or wave hands and arms to remove excess water. Walk backwards through the operating room door and dry hands and arms with a sterile towel before donning a sterile surgical gown and gloves.
I think that's interesting, Jared. The thing that stands out to me is the amount of space that is truly needed on that. You know, because I guess that's why they're always battling between, you know, the user preferences for a larger sink area, as well as, you know, the design preferences for minimizing that space area.
Yeah, I think most of the scrub sinks that we sell are of the larger variety as opposed to our compact versions. Usually they'll go to a compact if they are limited in space. And they need to accommodate that. So a case study, poor sink drain, sink or basin design. Toronto General Hospital, pressure from spout splashed water out of the drain. The bug behind outbreak was Pseudomonas. Okay, I'm sure everybody can read that one. I'm sorry?
Pseudomonas aeruginosa? I don't know. I tried.
Okay, I'll go with what you said there, Zach. From December 2004 through March 2006, 36 patients exposed to the intensive care unit or transplant units were infected with a drug-resistant strain of what was mentioned above. Has been increasingly recognized for its ability to cause significant hospital-associated outbreaks. This pathogen can persist in environmental reservoirs due to biofilm. And that's a thin film, thin slimy film of bacteria that adheres to the surface. 17 of the infected patients died within 3 weeks. For 12 of those patients, infection with the outbreak organism contributed or directly caused their death. Design solution, full-size scrub sinks, as Zach and I were talking about before. Full-size scrub sinks are made with heavy-duty stainless steel, feature gooseneck spouts, and offer available options that include a different valve and activation, soap dispensing option, 1, 2, or 3 stations, available in custom sizes, can either be mounted with a carrier concealed in the wall or have a pedestal base. The image on the left there shows your pedestal base. To activate the soap, you're pushing the soap panel on the left, and then it's the electronic sensor faucet that turns the water on. The other option too is to have a water push panel, so it's knee activated on both sides. Again, some of the scrub sink options that we have, again, mounting carriers for sinks, the pedestal base, a digital timer so they can track the length of time they've been washing, electronic timing controller, optional iFace wash that's built into the scrub sink. Laminar flow nozzles or plain end spout is also an option as well. A light module, metered liquid soap dispenser, splash panel, which would be used on a 2 or 3 station that would give separation to the users, soap flushing system, sensor operated faucets, as well as swivel nozzles on your goosenecks.
Now, some
Soap
of those
flushing.
may be more
Sorry, go ahead.
remotely appropriate than others, right? I know some regions say prevent the use of a swivel on a gooseneck, or require different types of laminar flow, and or, maybe they don't allow the rose spray that comes
Yeah.
with it. So I guess
Correct.
keep in mind that there's some regional specifics that are going to be tied to this.
Yeah, on the soap flushing system, if you do have a soap system built in, the soap flushing system actually is a really neat feature. It's built in, it flushes the entire system. It flushes the soap dispensing lines and the reservoir with hot water to prevent coagulation of the soap within. As we know, as soap sits, it tends to coagulate and could cause blockages, or again, you're getting old soap coming out as opposed to having fresh soap coming out. And again, the hot water flushes the entire system in seconds and makes preventative maintenance a real breeze. If you are going with the optional iFace wash, we do also include a separate mixing valve that controls that. So you have a mixing valve controlling water for the scrubbing of hands, and then a separate one that would be for your iFace wash. Our compact sinks, this meets U.S. State Pharmaceutical 800 requirements, requiring the sink to have an iWash station readily available. 797 requires hands-free use. On this, you'll notice the drain is offset. The faucet is sensor activated with a laminar flow. Front access panel to gain access to the P-trap, and your mixing valves for your tempered water, both on the faucet and the safety iFace wash if you have it. Again, this is available 1, 2, or 3 stations, can be modified in size. So if you have a certain dimension between walls you want to fill, let us know and we can build it to suit. Also ADA compliant as well. The iFace wash spray heads feature a flip dust cover of ABS yellow plastic, providing integral antimicrobial protection. Again, here's an image of 2 scrub sinks together. So it's these 2 individual stations as opposed to a double. A double would have left additional space there. But again, we could have modified it so it went wall to wall with 2 sinks. This particular one was at Sunrise Hospital in Las Vegas, Nevada. Infection prevention sinks. So again, there have been a lot of design changes over the years from what was originally supplied probably 15 years ago to where we're at now. Different materials, the key features behind all these remain the same. The basins are deep, drains offset. Any water dripping on the edge ends up going into the sink. In this case here, with this particular model, this is our Cortera version, or a solid surface material, makes it easy for cleaning. We have options for wrist blade handle or sensor operated, or even a foot pedal valve. And again, as mentioned, the drain is offset, so any water is hitting basically in front of that sloped area where the faucet sits, and then goes off to the drain.
And just a quick question coming in from the chat on, I think they're just looking for like, what are the differences of like a scrub sink versus this infection prevention sink, these hand hygiene sinks?
One of the things, size for one, you can see this one is fairly small compared to what a typical surgeon scrub sink is.
And also like your your location and use case, right? Your
Yeah.
scrub sink is going to be more staff oriented, say outside, more in a operating area. Whereas your infection prevention and your hand hygiene sink, if you circle back to that original case study, this is going to replace that sink in the room or on the entrance to the room.
Correct.
You know, if they're going, you know, often you'll have it say just outside a patient corridor or just outside a patient room. And
Yeah, you might have it in ICU areas where there's, again, as you say, one outside the room, one inside the room. So you're washing as you go in, you're washing as you come out. And it could be used in the hallways. We also make a version of this that meets barrier-free requirements as well. And again, it has the same options on faucets. If they wanted, we could do foot pedal valve, but I would think that would be a non-starter for somebody in a wheelchair. So it'll either be sensor or potentially wrist blade. Wrist blade is considered hands-free as well, just in case anybody is asking about that. So.
yeah, thank you. Good question.
Design solution, eliminating seams. So another approach to eliminating places for germs and harmful bacteria to grow is avoiding products that necessitate the use of seams between materials or in materials themselves. Avoid these options where bacteria and mold thrive. Undermount basins. Yeah, you can have a nice solid surface top, but again, you're going to get a seam where that bowl connects underneath the basin. Again, drop-in basins for obvious reasons. Again, you've got an area where bacteria is going to grow there. Any surface that has a seam or a joint, image 3, for example, 2 pieces of laminate, and even then laminate itself is not looked at anymore because basically it's particle board with a laminate finish. And again, if that particle board gets wet, swells, again, there's a buffet for bacteria to grow. So another design solution, solid surface with integral steel basins or solid surface basins. Again, it's a couple of versions here that we're seeing where we have a corner sink on the top, and that's got an integral Cortera basin built in. And again, you notice the drain is offset. It's not right underneath the faucet. And again, you can put a variety of different faucets into that. We also offer a sidewall base in the lower right picture with an integral stainless steel base. So again, you can have that stainless steel built into that as well. And again, the drain is offset. So when you look at the flow on that faucet on the bottom, it actually falls in front of the drain, not right into the drain. And again, if you go with the stainless steel base and it's seamless. Next thing we want to touch base on is dialysis boxes. We've got a wide variety of dialysis boxes. I was told once, although on our website we show maybe 12 different varieties of dialysis boxes, in reality, we've got about 900 different variations that we've done in one way, shape, or form over the years. So if you don't see it on our website, please give us a call. I'm sure we've got something in the background that's close to what you're looking for. One of the things that we're seeing a little bit more of now is these dialysis boxes, not necessarily being used for dialysis, but being used for draining, where they have a condensate unit up in the ceiling space and they want to dump the water somewhere, and it happens to be near a room. We've been modifying dialysis boxes with a drain connection, say in the top, and we're providing a 2-inch outlet on the bottom of it. We can provide stainless steel or PVC ball valves, single or dual, stainless steel cabinets as well, either 304 or 316, with a locking door as well. Traditional systems, as you see, each room in the image on the lower left, each patient area has a separate dialysis box, and you're running lines from a mechanical area where your backflow preventer is, and you're running a line directly from that area to each room and back. So you can see quite a bit of piping is used, quite the number of hangers as well to get all that piping in and all that installation cost. So for something like this, we're looking at a 12 room or 12 room setup, 840 hours of labor. So just the labor alone is $128,000 for something like this. And again, these are US costs that we're referring to here as well. Well, the solution we have to that is to have one dialysis block at each bed, but to include all the necessary requirements, such as a backflow preventer, an RP-type backflow preventer. It isolates the system on a patient-by-patient basis. Safely uses potable water. Water is tempered, so we include a mixing valve within that cabinet with a dial temperature gauge. Again, controlled for safety, minimizes liability, save money with reduced installation time for the plumber. Dialysis box in the patient rooms, there's no need to take the patient to a dialysis center. So whether, again, if you've got these multi-use rooms, if the patient doesn't need dialysis, great, they've got an available bed. But if they do need it, again, they're going to have a box like this within the room. We offer also a trap seal primer to prime the P-trap that also happens to be at the bottom of this box. Again, as you get it on site, as you see it in the pictures there, it's fully plumbed and ready to go, basically plug and play. There's also a drip tray that leans out, so when you're running your tubing from your dialysis machine back into the box, it's any water that might drip on the tubing will make its way into the drain in the box. And as you can see by the diagram on the lower right, you're basically just running one cold water line in a loop going through each room. Again, we're including the backflow preventer, thermostatic mixing valve, and the trap primer. This was actually designed by a contractor in the US that saw a need and licensed the rights to Whitehall Manufacturing to make these on their behalf. And again, we can do this either tempered water or having a thermostatic mixing valve built into it. Okay, so designing for behavioral health, and this is really a big item that's been happening a lot in the last number of years. Our healthcare system has been woefully adequate in being able to deal with mental health. I speak from experience on this through family members that have gone through and are still going through mental health issues. Again, if you follow the funding, and again, talking about US numbers, you're seeing here abuse prevention and treatment, 1.5 billion, certified community behavioral health, 420 million, pediatric mental health, 14 million. So you see the money is being spread all over the place. Youth suicide prevention. So again, there's a lot of stuff related to behavioral health that's being invested in, not just in the US, but here in Canada as well. What is behavioral health? So behavioral health is a term that is often used interchangeably with mental health, encompassing all treatment of psychiatric illness, includes multiple methods of promoting well-being by preventing or intervening in mental health or mental illness. Depression and anxiety, preventing or intervening in substance abuse or other addictions. This is a picture here from the Methodist Medical Center in Midlothian in the US. Again, far cry from what you currently see now in some of the older facilities that haven't upgraded to something that's a little more pleasant for the person suffering from mental health. But again, growing need for behavioral health. According to the CDC, 45,979 suicides were reported in 2020, the 10th leading cause of death for Americans in that year. Hangings are the second leading method of suicide at 26%. Someone in the country died by suicide every 12 minutes. In America, someone attempts suicide once every minute. 90% of people who die by suicide have potentially treatable mental disorders. at the time of their death, one that has often gone unrecognized and untreated. Statistics from 2018 from the U.S. Department of Veterans. In 2015, an average of 20.6 veterans died from suicide each day. 6 of 20 veterans who were recently used VA services. In 2015, veterans accounted for 14.3% of all deaths from suicide amongst U.S. adults, while veterans constituted 8.3% of the U.S. population. In 2014, approximately 58.1% of all veterans who died from suicide were 50 years or older. So it's important to find a happy balance between safe and environments that are helpful in accelerating the patient's recovery. Nonetheless, as the data shows, the preponderance of inpatient suicide by hanging is an area requiring increased focus and action. And you can see the different methods of committing suicide, what people are doing. So what does ligature-resistant mean? Ligature-resistant products have features that prevent the attachment of ligatures in order to protect patients. Ligature is defined as tying or binding. Identifying ligature points. Replacing only the faucet is not enough. There are many ligature points in a standard patient bathroom. Again, what is a ligature point? It is defined as tying or binding. The Joint Commission has defined ligature resistant as without points where a cord, rope, bed sheet, or other fabric material can be looped or tied to create a sustainable point of attachment that may result in self-harm or loss of life. So in this standard image that we have of a bathroom, although yes, it meets barrier-free requirements, do you see the ligature points here?
Yeah, I mean, there's a handful that definitely jump out to me from the, the grab bars right off the top, around the flush valve, the gooseneck faucet. I'm sure there's a lot more on there too.
Let's see how many we truly have. So here's all your different points. So paper towel, toilet tissue dispensers. Again, Zach, you mentioned a standard or gooseneck faucets, light fixtures, grab bars, your shower fixtures, curtain railings, shower seats, sinks, toilets, flush valves, and I skipped one, drains.
Yeah, I was gonna say the
And
trap doesn't have it.
What's that?
The trap doesn't have an arrow.
Correct. And also the trap should be listed there as well. But when you look at drains, well, how does somebody commit suicide using a floor drain? Well, if you look at how a floor drain looks, you have the grid. Basically, it's tying a shoelace, wrapping it around your neck, and then doing the alligator roll on the floor. Eventually, at some point, you will get it tight enough where it'll cut off your breathing. So Dr. Lorna Breen, Healthcare Provider Protection Act. Healthcare professionals have long experienced high levels of stress and burnout, and COVID-19 has intensified the problem. The Dr. Lorna Breen Healthcare Provider Prevention Act was developed to promote mental and behavioral health amongst healthcare workers. So again, we're not concerned so much about just patients, but it's also the staff as well. Support suicide and burnout prevention training and health professional training programs, and increase awareness and education about suicide and mental health concerns amongst healthcare professionals. Again, they talk about providing grants for training to deceased, prevent suicide, burnout, mental health conditions, substance abuse, seek to identify best practices for minimizing and averting suicide and burnout amongst healthcare professionals, create awareness campaign to encourage healthcare workers to source treatment for mental and behavioral health concerns. Establishes grants for education and behavioral health treatment, and institute a study on healthcare professionals' mental, behavioral health, and burnout, incorporating the effects of COVID-19 pandemic. Again, there's no set standard for dealing with behavioral health, like a CSA requirement. One of the guidelines that's used a fair bit, not just in the US, but here, I'm sure a lot of you are familiar with the New York State Office of Mental Health. They have a patient safety guideline that covers everything from right through all divisions of construction. Several states look to the New York State Office of Mental Health guideline as it has the most comprehensive guideline for construction and renovation of behavioral healthcare products or projects rather. The document is intended to provide guidance. So it's not a code, it's a guideline with respect to patient safety features in inpatient psychiatric environments. It provides a directory of materials, fixtures, hardware that have been reviewed and supported for use in inpatient behavioral facilities to advance the agency's goal of minimizing the risk of harm to people in inpatient environments. They release this twice a year, usually in January and in July. A couple of email or web links to get to it, and you can download. It's a fairly large document, but like I say, it covers everything under the sun: light fixtures, plumbing, architectural products, door hardware, the whole 9 yards. Department of Veteran Affairs design guide, again, is intended to be a transformational document reflecting the important psychological impact environments have on patients and staff. In addition to providing technical, architectural, and engineering specifications, this design guide emphasizes principles and strategies for building state-of-the-art, recovery-oriented environments for mental health settings in Department of Veterans. Again, when dealing with your clients, what are the clients looking for? Again, as I stressed before, the New York State Office of Mental Health is a guideline. There's a lot of different manufacturers that provide products that work well in healthcare facilities. What does your facility need? Again, the guideline is a good thing to go by. It gives you things to look at and to consider. Again, the Joint Commission, this was a US thing. Industry is now designing to be Joint Commission approved. Joint Commission is an independent, not-for-profit organization that accredits and certifies nearly 21,000 healthcare organizations and programs in the United States. I'm not aware of anything like this in Canada at this point. So we'll just leave that at that. Now, unless you are working on projects in the US, again, those facilities would need to be Joint Commission approved. Again, government healthcare regulations, CMS or Center for Medicare and Medicaid. Hospitals must meet eligibility standards established by federal government in order to receive reimbursement from federally funded programs, Medicare or Medicaid. CMS has been designed as an organization responsible for certification of hospitals, deeming them certified and meeting established requirements. And again, that ties back to the Joint Commission doing their review. Flexible design, universal design, specifying fixtures and accessories that are manufactured from durable materials that promote ease of maintenance, being ADA accessible, meeting bariatric requirements, infection prevention, aesthetically pleasing, affordable, retrofittable, a universal design, and quick install capabilities. As mentioned earlier, hanging is the most common suicide method in behavioral health, with 75% of suicides occurring in the patient bathroom. 50% of all suicide events result in legal claims. So again, it's to the hospital or the facility's best interests to eliminate as much of the areas where people can hurt themselves as much as possible. Again, having dual occupancy rooms that are designed for behavioral health care environments, but also ideal for Veterans Affairs. Ligature resistant and universal design, barrier-free accessible, great for new and retrofit projects. Again, when you look in the basin in the background there, that's a one-piece, two-sink lab assembly. Again, made to fit wall to wall to whatever the distance that happens to be. Again, has the apron below to conceal all your plumbing. And a lot of the accessories you see there are also available through Whitehall. Again, ligature resistant toilets. Additionally, stainless steel toilets are designed to be wider behind the bowl, reducing potential ligature points. China bowls can be broken, create ligature points, have sharp edges, potentially lethal weapons. Heavy gauge stainless steel toilets will minimize potential for breakages, and when powder coated white, will offer a less institutional look. Also, one thing to note on stainless steel toilets, they'll deflect a load of 5,000 pounds. So again, when it comes to bariatric use, Again, stainless steel is going to handle that. Again, ligature resistant toilets, NABH design guide. New toilets should be floor mounted with back outlet and back water supply. Movable seats are not ligature resistant and should be avoided. And then flush valves and all related pipes should be enclosed with stainless steel or plastic covers and have a sloped top. So again, on the 3 toilets that you see there, we have, although the bowl, as you saw in the previous picture, has an integral toilet seat, we also offer a plastic seat that is bolted at the back and on the front underneath. So it's not a hinged seat, but it's bolted directly to the toilet. So instead of sitting on the stainless, you're actually sitting on plastic. If your flush valves are exposed, again, we have different covers. We also offer a tank style toilet as well, a gravity tank. And then if you've got a conventional flush valve concealed in the wall, we offer the access panels to go with that as well.
So
the one thing I will mention.
Sorry, just a quick question on the tank style toilet. Is that a gravity flush toilet, like that's a cistern, or is it a flush valve that's concealed within that?
No, it is a gravity tank, so it has the same kind of flush valve assembly in it that your toilet tank at home will have.
So if you're doing a retrofit where maybe you have pressure concerns, this would be a great option.
It would be a great option, and again, depending on what the floor roughing on the existing toilet is. We did a project in the US where they had existing flush valve toilets that they wanted to make ligature resistant. But they couldn't order just one type of toilet to match everything. Believe it or not, they had 80 different rough-in dimensions. So from the finished wall to the center of the drain. I don't know what the plumber was doing when he put these in, but he was all over the map. So we created 80 different toilets. Each had to be numbered or room tagged, so they knew exactly where they were going. So again, we do it all the time.
That is chaos.
The other thing I will mention too about the gravity tank toilets, again, they're gravity, they work like your toilet at home. One of the drawbacks to using a gravity toilet in a healthcare facility is that sometimes patients, depending on the medication they're on, their stools get harder. Flush valve toilets deal with that. Gravity toilets do not deal with it so well. So be mindful if you're considering using a gravity tank. We have looked at getting a pressure assist toilet put together. And I've been following up with Whitehall and seeing to try and get that. It just hasn't been at the top of the list of getting done, but it is something that they're looking into. And that would eliminate that issue happening. But for now, if you've got existing toilets that are flush valve, please stick with flush valve toilets. Don't go to a gravity tank. Safe, secure fixtures, ligature resistant flush valve access panels. So again, you're seeing here, we offer a sensor version, and one thing with Whitehall, we do supply flush valves. Our flush valves are manufactured by Sloan. We don't hide that fact, we actually promote it. We've had a great relationship with Sloan in the US for probably 15 years now, and even on our Acorn products, whether it's our penal fixtures or anything else, or urinals, we provide Sloan as our basis of design. If it's an existing facility that's using another brand's flush valve, we can do flush valve by others, and you would need to specify whatever brand you're using on that. You'll notice in this panel here that basically you've got 2 panels. It is one frame that allows the grab bar to span over the frame. The 2 panels are separate. Basically, the reason for the 2 panels, the high one gives you access to the head of the flush valve. The one at the bottom gives you access to the connection on the toilet. If you are using a standard panel that's basically the same size as the top one that's shown there, you're going to have difficulty getting that in the right spot to where you get access to everything. And more likely, your grab bar is going to be spanning right across that. And as you can see, it doesn't sit flush to the wall, so you're going to have difficulty there. So again, this is a great option to go. Now we can either have sensor as shown there, or we can do a push button operation as well. Your flush capacities are your 1.28 or your 1.6, and they're also ADA compliant. Again, when we're talking about showers, conical shower heads, whether they're mounted on the wall or from the ceiling, they're stainless steel, they're not brass or chrome plated, so they're solid stainless, polished, both ligature resistant and vandal resistant. There's no exposed bent arm and flange that's sitting there that would be a ligature point. According to the FGI guidelines, the 2022 version, single knob mixing valves that provide minimal opportunity for tying anything around them are preferred. So you see the handles that are on the showers here, they're a tri-lever handle. Again, you can't tie anything around that, or even getting it around the handle in between the handle and the escutcheon is virtually impossible to do. And again, these are also ADA compliant as well. Good shower bases. So instead of the traditional terrazzo or tiling in place, we have our Cortera solid surface bases that we offer. They're non-slip matte finish, solid color, powder coated white stainless steel integral trench drain. Trench drain is sloped from sides to keep the water from pooling at the top, reduce growth of harmful bacteria. That grate can be removed to expose the drain underneath. Again, ADA compliant or non-ADA sizes available, and we also do custom sizes. So again, if it's something existing and you need to meet a specific dimension and location for the drain, again, that's available. And then a list of the 9 different colors that we offer on it as well. Again, we talk about ligature resistant floor drains. Again, whether it's round, square, or if you're using vinyl tile like Ultro, if you look at Ultro's installation guidelines, they specifically detail what drain models, and I think they list 4 or 5 different drain models that can be used. Again, if you're looking at just your standard floor drains in the middle and round grate on the left, again, we're offering both those. The one on the right is for your vinyl flooring. Basically, your floor drain body, a flashing pan. Your resilient flooring goes down first, then the vinyl floor head goes in, and then your grate goes on top. So if you ever have to service the drain, unplug it. You take the grate out, but you're not touching the vinyl floor head. That keeps the seal intact. If you do not use that type of drain on Ultro flooring, they will void the warranty. We also make tops that, if you've got existing drains, we do retrofit tops that'll fit in a variety of different drain manufacturers. These are based on J.R. Smith models, which you're seeing in the image here, but we also do it for other drain manufacturers as well, both the blue guys and the gray guys. I believe we can do the red guys as well.
Specific for the grate, you know, I know the image shows a fairly large area, and it almost looks like you'd be able to, you know, maybe wrap some string or shoelace or anything in between those slots, but those are blocked, are they not?
They are blocked. So where you look at where the circles are, in this area here, you see where they're tied, where the individual circles are. They go right down to the bottom. If you're looking at the top grate on the upper right, there's quite the assembly underneath that prevents anybody from putting whether it's thread, a shoelace. It'll go down, but it won't go any further. So there's no way of locking it in place. And again, once everything is installed, everything is flush. If it's installed correctly, everything would sit flush, so they're not able to tie around the screws. There are vandal resistant screws that are used. We also do this on a trench drain as well. So if you need a trench drain, on the lower left side there, you see a sample cutaway of the vinyl flooring. So you see how it goes up along the wall there for the base. But again, you see only the grate, you don't see the vinyl floor head. And again, we talked about the trench drain. So again, there's a rim around the trench, around what is the grate, that allows the water to drain in. And I will say this, it is not a great draining floor drain as you would normally have with a regular floor drain. The free area on a regular grate is far more than what's on the ligature resistant one. So you're giving up, pulling a little bit more water in the shower before it drains out, but you're getting the ligature resistant aspect to it. Linear drains are designed without perforations, again, to prevent ligature points. The hidden shield under the drain cover also prevents ligature points. Ligature drain covers can be used as a threshold for showers, thus making them ADA compliant, so you can run it right across the front of a shower. They're ideal for ligature resistant applications or universal design where wheelchair accessibility is a must. They can be added to integral shower bases where they are recessed into the floor, providing a seamless appearance. And again, looking at the image on the bottom in the middle, shows you the makeup of the drain. So you have the body. Again, if you're putting the seamless flooring in, you've got the clamp that locks that in place, and then you have your grate that goes in on top of that, locking the whole assembly together. And these could be made to whatever length is required.
Yeah, go ahead. Sorry. I was just going to say, compared to, say, a point drain, where a user could easily block, the small number of drainage air, the amount of free area available even on a point drain compared to a linear drain. The linear drain is going to be much more challenging to try to block all the water going in it.
Correct. Again, adding faucet, toilet management systems to your facilities, manage water usage ranging from one plumbing fixture to an entire facility. We have automatic toilet flood control that we can offer on our toilets, again, using our MasterTrol system. Again, this is something that would need to be done from scratch. It's not a retrofittable item that you can run with. And this would be used on showers, lavs, toilets. Again, we talked earlier a little bit about alcove applications with ligature resistant sinks. Again, they can be singles, 2-station or 3-station. Again, the different colors, and they can be made to whatever wall-to-wall width you have. We do offer standard sizes, but again, if you're doing an existing facility, again, they would make these to suit whatever dimensions you have. And then you'll also notice that we have different bowl types. So you can either have a round, there's also 4-station there as well, but you can have square bowls or round bowls, or a combination of the two. Again, if you want to have that real design flair, we give you that option to go with as well. The trap enclosure below, you'll notice that there are actually individual plates that are below to get at everything. I was at a recent installation where they had a custom stainless steel basin put in that went wall to wall. It was 14 feet long, had 4 basins in it, and there was not one access point to the P-trap enclosure below. So if you had to service it, you had to peel the pick-proof caulking that was used. You had to unfasten, I think there was 18 screws to remove it. So again, one of our key features is having access to get at the plumbing underneath. So be mindful if you are going that route, if you are looking at getting something made, make sure to have access ports in that apron cover underneath. Again, ligature resistant sink basins. Again, if you're not going wall to wall, we do offer solid surface. Again, integral bowls where they're open on both ends. We've got the backsplashes and the side splash. Again, if it's going in a corner and you want a little bit of a deck area, again, the one on the lower right gives you that feature. And then the Dignity Suite, the single basin that's to the left. Again, it's a normal, what they call a normalized looking sink, so it doesn't look institutional. Short of putting a sensor faucet and a ligature resistant drain, if you use the fancy faucet and a regular pop-up drain, again, that might not look too bad in your house in a powder room. So again, something a little bit more with a nicer design that gives you sort of a more of a homey feel to it. And again, all the 9 different colors that it is available in. Blanco matte seems to be the standard that we've been using for a while now. So again, we also have our ligature resistant faucets that is designed with sloping surfaces and minimal protruding buttons to minimize ligature points. Faucets are designed with both new construction and retrofit in mind. Again, the picture on the left there, the gooseneck with the blade handles, 3 great ligature points are on that. If you look at any of the 3 faucets that are there, Sensor operated on the left, has hot and cold adjustability to it, so you wave your hand left or right side to adjust temperature. The one in the middle and the one on the left, you would have, again, a mixing valve, and even the sensor, you'd have a mixing valve tempering the hot side. But those to the middle and the right are two push button units. One is an actual button that you're pushing. The one on the right is a piezo style, so it's touch sensitive to get hot and cold water coming through. They can be used on any basin. Basin on the upper left is a stainless steel basin painted white. And then again, we've got the one that we showed previously that again has spaces, single user, side splash, backsplash, could be open on both sides of it. Again, getting into grab bars, again, we have ligature resistant grab bars in several different colors. They're fabricated out of cast aluminum, powder coated to reduce an institutional look. So instead of having your traditional stainless steel grab bar, we do them in a blue or a white. We also have weave holes in the end caps for drainage. So if you're using it in a shower area, you're not holding water within the grab bar, it will drain out. Again, we also have shelving at a solid surface, sloped edge design again, so it's ligature resistant, galvanized steel mounting frame, magnetic lock systems can be installed vertically or horizontally. Again, you're also seeing where the toilet is shown. You've got a horizontal shelf, whereas on the right it's vertical. And we offer the paper toilet paper holder as one of the options as well. That's also solid surface. Again, you've got all the different colors of solid surface material that you can put in. So again, you can add a little bit of design look that doesn't make it look institutional. Again, we have combination mirrors with shelves or just a mirror only. Again, this is a solid surface frame and a polished stainless steel mirror. Again, different colors, we offer different sizes as well. Again, your toilet tissue holder, no more having to worry about where the spindles are going. Again, it's slope design. The roll just sits on the inside of it, no spindle at all. And it fits your standard household toilet paper roll. Also comes with a galvanized steel mounting frame. Here we've got other paper towel holders and toilet tissue holders. Also paper towel, whether you're using the C-fold or multi-fold paper towel, single bay or 3-bay. When you look at the paper towel holders on the left, they've actually got a ball on a spring that when you push the roll in, it kind of locks it in and it's easy to remove. We do that both on paper towel and toilet paper. Again, standard color in all these is white. If you're looking for a different color, that is available as well. And again, you'll see that some of these are rear mount. We also offer front mount accessories as well. Therefore, we focus on safety. Safety should be invisible. Remember, 75% of suicides take place in an inpatient bathroom. Patient of size bariatric products. So we offer a variety of bariatric patients. Again, whether you're putting a stainless steel toilet painted white with a bariatric seat, make sure that you're using the appropriate carrier in the wall to support the weight load. And again, the stainless steel base, and they were painted white, again, using the appropriate carrier to deal with the weight. Again, just an idea of where weights fall in, again, from underweight up to clinically obese. I know I've been going to my doctor saying that I'm vertically challenged, and I'd like to agree with them that I am vertically challenged for my height. So I'm sure some of you might be getting that from your family doctor as well. Yeah, we talked about with the bariatric toilets, not just a regular carrier will do on the wall. Again, it has to be specific for 1,000-pound weight load. When you're looking at our toilets will actually hold a 5,000-pound load. But again, carrier is required to do that. 5,000-pound load on a floor-mounted toilet is the best way to go. But again, if you do have existing wall hung toilets, again, we do make the stainless steel ones. Again, it's a regular size bowl, but we put the Big John toilet seat on top of that. Again, your bariatric lavatories, again, having the appropriate carrier in the wall is the key to it. Again, basin being stainless steel, having your apron underneath to conceal all your plumbing, and it's got an access point below to get access to all your plumbing. Could be for non-behavioral health care as well. Again, this basin here is ligature resistant and has 1,000-pound capacity. Sources for a lot of this. If you need these, let me know. I'd be more than happy to send them out. Again, we talk about best care from Whitehall. Again, it's universal design, consistent across all rooms, enhanced aesthetics. Again, not looking institutional. Again, the biggest thing when it comes to dealing with mental health, you've got people coming in that are ready to jump off the cliff. You're trying to get them off the cliff into a comfortable place. So again, that's where this comes in handy. Again, quick installations, all-inclusive suites, whether it's new construction, retrofit, or ADA packages are all available. Available on Master Spec and Revit Autodesk. And just go to our website, www.whitehallmfg.com, or you can send an email to sales@whitehallmfg.com to get those specific details. And again, on our website, you'll see the 3-part spec for Master Spec. We do a quarterly newsletter that we send out. So if you're interested, you can register for that. And there's all sorts of information about healthcare design, not just in Canada, but in the US as well. So again, these different authors that are putting in great information. So again, if you sort of want to be on the uptick of what's going on North America wide, this would be a good idea to register for that. We also have our trailer. Some of you may have seen our trailer. There is a new one that they're working on that we'll have available, such as the pictures that you're seeing here. We're working on finding out when we can get that north of the border. So hopefully at some point this year we can get that up here. If you're interested, we will let us know. Let Zach or myself know, and we'll certainly start pushing to get timelines for it to come up. If you happen to be at CMPX next week, we will be showing some of this product on display at our booth at booth number 803 for Morris Lee. So please drop by and say hello. And we do offer CEU courses from Whitehall. There's 5 different ones that are available, all available through our website. So please take a look. If you're not sure where to find it, give me a call, let me know. Be happy to send that out to you. And with that, I thank you for your time.
Great, thank you, Jer. Yeah, I think we've had at least the top 3 of those CEUs during the ATS University sessions over the last year. And obviously just finished off the advances in plumbing design for healthcare that you just presented there. Thank you so much for that. Now, I would be, I recognize that we're running a little bit over time and appreciate everyone spending the extra 5 minutes with us so far. We'll be keeping an eye on questions. I do want to show you beyond just Master Spec where you can find the products all available here. All the Whitehall and the Morris Lee Group has been a sponsor of the ATS Spec tool for a number of years now. And if you go to atspec.com, you'll be able to log in with your free username and password associated with your firm's account, so you can share projects across manufacturers. Before you even log in, you can go to the Architects and Engineers tab here to go to the Learning Hub and access the previously recorded webinars like I mentioned at the top of the session. So if you missed anything today, you can go back and check it out. As well as we have a knowledge base with a number of design guides, sizing guides, application-specific blogs, and of course our templates, which is a newly launched feature in the last year that essentially is a recommendation of products based on applications, similar to maybe your internal firm's master for a specific application type. you may have a hospital master or a long-term care master, and you could use this to download either a US product version or a Canadian product version, which is going to give you appropriate barrier-free codes in whichever country you're downloading from. You can also just log in, hit start now, and start building a project where you can choose to add that same template directly within the field. If this is your first time seeing ATS spec, please feel free to reach out to me, zach@atsspec.com, and I'll be sure to show you a deeper dive into the system. Essentially, you're going to set up your own projects. You can share these again across your film. You can see I've set up a hospital mental health facilities webinar here, where I've got different product groups, the more fixture oriented products, the more accessory oriented products here, so that you can download them separately. You can either download individual product groups or an individual product. So if I just want this one product, I'll click this box. If I want the whole group, I'll click this box. If I want every product group, I'll click this box, and I can download, I can use my template really quickly to finish off the project. So I've got the first mental health fixtures done. I've got my accessories done. If I want to add my hand hygiene sinks, I can go through and add the Whitehall hand hygiene sink, vary in whichever version I want. I could add those scrub sinks that we talked about and put in a Whitehall scrub sink if I wanted. I could go into the drainage products and add my entire field of drainage, or interceptors, mechanical, pipes and fittings, fire protection, all sorts of products that we could go in, select a product group, copy that over to the project that you've already set up, or create a brand new project just by clicking the new. So it's a combination of using your individual products that you may think are appropriate for the project, as well as using either an ATS template or your own firm master, which of course you can access these all on the left here as well. So that project tab, this masters would be your firm's masters. So your version of, say, a long-term care, or your firm's version of a mental health ward. Or the ATS version of a mental health ward. That's kind of the separation of the two there. Of course, everything is all easy to revise. If I want to change out this toilet from the gravity version to the flush valve version, I would just hit the edit button here, and it would take me to the product configuration page. The plus button that was just on the last screen would show you how you can start configuring your products, but you can filter down, say, by Whitehall. Once you're in a category, we have all these filters on the left that help you choose the appropriate products. But you can see I've got all these different options here, and I could say change it from the gravity to a barrier-free tank type, where I can then configure everything. So I want an on-floor wall outlet. I want, I don't need to select my rough-in because it's a wall outlet. I could choose my flush valve flow rate, so I can go with the 4.8, and then it can configure, whether I want that gray toilet seat, a white, or a black, and any other options that are built into that product selection. You can see it's also providing supplies or anything else that's needed to go with the fixture. Once you've done your selection, you would then hit complete, and we'll just say download this particular product group. I'll hit download, and then I could download anything from my submittal, my fixture schedule in Excel. They've got 3 different written spec formats, including the 3-part spec that was referenced earlier. But I could get a short spec or a long spec. I can get the manufacturer spec sheets. I can get the Revit for the entire project, and I can even get product brochures. Now you can see once you've done an entire project, this is what it looks like when you're downloading all those different formats all at once. It's a great time savings, but keep in mind, you get a lot of information there. So what that looks like in our PDFs would be your submittals here. Submittals for the accessories. And I mentioned the written specs. We'll jump over and show either this would be a long spec format. All these are open and editable. So if you end up, say, not wanting the supply, you just delete the supply. You can copy and paste this directly into your own internal written documentation. You also have the CSI 3-part spec that we referenced, which is going to provide, a product session with your basis of design models at the end. And of course, you can put in your approved alternates as needed. And then similarly, our schedules here. We're looking at our fixture schedule. And all these schedules, you can see we've got a plumbing schedule, drain schedule, there'd be an accessories schedule, a backflow schedule, dialysis box schedule, whatever you have, everything's going to be customized to have different headers that are following the industry standard for those headers. And then of course, here we've also got all the Revit files that we could download. So if I was looking at the Revit files, you've got a file for each of the product types based on their, based on the the fixture tag. And these are LOD 200 with a minimal file size to try to make your Revit as user-friendly as possible. Now that was probably the quickest demo I've put together, but hopefully that answered any of your questions of how you can find the products that we talked about today. And if there's any further questions, I'll stick around for a minute or two. But thank you very much, Jerry, for that detailed conversation. That was a fantastic deep dive on mental health and scrub sinks and all of the, how we're preventing infections for the healthcare, the HAIs, as you mentioned. Thank you once again for coming in. And if you are down in Toronto next week for the CMPX show, stop by the Whitehall booth and say hey to Jerry and thank him for providing multiple sessions for us over the years. I'll see you next week, Jerry.
Thanks, everyone.
And I just saw a question come in on the dialysis box. Yes, thank you, Carlos, for reaching out. I will shoot an email over to you shortly, and we'll get an introduction with, I'll probably loop Jerry in and myself. Thank you so much for your time. Thank everyone for joining us. If you need your certificate of attendance, we'll have those out probably on Friday. Have a great one. Bye for now.
Thanks, everyone.